He's a consultant gastroenterology in King Khalid National Guard Hospital in Jeddah, and his talk will be an important one in our society. It's colon cancer in Saudi Arabia.
Assalamu alaikum. So my task is very simple. It's to go to review the literature about what we have, because I don't think that we have a lot about our local data, but it's pointful to share it and to see how we share with the rest of the world. So this is from our cancer registry. Colon cancer or colorectal cancer was number 4, moving up next year to number 3, and since 2002 globally it became number 2 and stayed there from all the cancers both diagnosed in males and females. And as Dr. Umar already showed you the slide before, that in males is still number 1 according to our 2007 cancer registry. I wasn't able to reach the later one. The Saudi Cancer Registry site doesn't allow for the newer registry access, but maybe Dr. Sani has more information about it. So it's still number 1 for males and probably number 3 in females. And is it an adult disease or do we see it in children? So it's probably an adult disease because we don't see it in children in our registry. But fairly, if you count all cancers according to male and female, both sexes in all ages, it's still number 2 behind breast cancer. While breast cancer accounts for only 13 or 14%, colorectal cancer causes about 10% or is only 10% of the cases. So do we really need to bother? Look, 10% from how many cases? The total number of patients diagnosed within that year, 2007, was 900 cases. We have a lot of people dying from other reasons, from car accidents, from more national health problems, floods, rains. So do you really need to bother, invest money into this, put lots of resources from the country, from the government, from professionals like you to go spend time and look for it? That's the question I leave you to think about. Look, our 5-year survival. Previously, in the 5-year survival calculated, I don't know if that's a measured one, but it's a calculated, estimated 5-year survival, is 41% for males and 50% for females. And are we doing better over the years? Look, from 1994, 44% globally for both male and female, and in the next 5 years, the same figures. I don't know about the later years, we don't have data for that yet. So compare this to other malignancies in Saudi. So compare this colorectal cancer with breast cancer and the 5-year survival. So even the 5-year survival for breast cancer is better than us, while the horrible liver cancer is, as you know, the 5-year survival as you would expect. How we are from the rest of the world? Well, we're not that low, but we're not that high even. So we are just like in football. This curve is very important to me. Look at this age-specific incidence rate. The usual Western population talks about 50 as their cut mark for the rise of the colon cancer figure and curve. In our cancer registry, it talks about earlier. From about 40 to 45, you can see about 10% of your cases there, or 10 per 100,000, I mean. So I'll go now about the published studies that I looked into and I found in the literature in the PubMed. I'm sure there's more studies that are probably not indexed, so we missed them, or indexed in a different modalities than PubMed. So one of the studies was done here in Jeddah, in King Abdulaziz Hospital, published in 2002, between the period that they did their collection from 1992 to 1997. And their conclusion that I want to draw your attention, that the majority of their patients, they presented advanced stage. Another study from Jeddah again, probably a similar period but a longer duration. The total of their patients were 110 or 111. And their conclusion that they see patients at younger age in advanced stage. Dr. Al-Jibreen from Riyadh did another study from 1995 to 2005. Total of 113 patients again. And they look at the conclusion again. Advanced stage of presentation at a younger age compared to Western population. So I went again and looked into my home data, and this is my data for 5 years in my institution, and this is the numbers of the cases over the 5 years, 2004 to 2009, or 6 years, sorry. We had 58% males and 41 females, and about 1/3 of our patients are below the age of 50. We had as young as 15 and as old as 112. Whether this is a real 112 or not, I'm not really sure, but that's what we had in the files. And the majority of the cases are in the left column, not in the right column, as you would expect. So look at the stage when they presented. 64% again C and D, Duke staging. For rectal cancer, the majority, 84%, are in T3 and T4, something that we can pick up with a digital rectal examination. And for M staging, 40% had metastasis. So we should be looking at ourselves again in the mirror. Are we doing a good job and what we should be doing? So again, in the same period, in the same time, King Abdulaziz University gave out their data. Big number again of patients, almost 177 patients, and in addition to 414 of our patients. And they have the same conclusion. Patients present late in advanced stage. So with that, I conclude my review of the literature. And I leave you with the challenges that we should focus on how do we screen this. The point of this session is to drag your attention, is to ask you questions, is not to give answers. So, Dr. Asmani, the chairman, thank you. That's my conclusion.